This medication is used to treat the symptoms that occur with certain blood disorders, porphyrias. Hemin is not a cure for porphyria. This medication may relieve symptoms such as pain, high blood pressure, rapid heartbeat, or mental changes that may occur during an acute attack of porphyria. This medication is administered through a vein by a healthcare provider. Your doctor will determine the dosage based on your weight, medical condition, and how you respond to the treatment. If you experience any discoloration of the skin or pain, tenderness, or swelling along your veins, it's important to let your doctor or pharmacist know right away. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. While many people using this medication do not experience serious side effects, it's important to tell your doctor if you notice easy bruising or bleeding. A very rare but serious allergic reaction to this drug may occur, so seek medical help immediately if you notice symptoms such as rash, itching or swelling, dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice anything else, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Panhematin Vial, make sure to let your doctor or pharmacist know if you have any allergies. This product may contain ingredients that can cause allergic reactions. Also, tell your doctor or pharmacist about your medical history before using this medication. Since this medication is made from human blood, there is a very small chance of getting infections from it, even though it goes through a special manufacturing process and is carefully tested. Before having surgery, make sure to inform your doctor or dentist about all the products you are using. If you are pregnant, this medication should only be used when clearly needed. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. Certain medications may interact with Panhematin Vial, affecting how it works or increasing the risk of serious side effects. This list may not include all possible drug interactions, so it's important to keep a record of all the products you use and share it with your doctor and pharmacist. Do not change your medication dosage without consulting your doctor. Some products that may interact with Panhematin Vial include barbiturates, blood thinners, and corticosteroids. If someone has taken too much Panhematin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for medical help immediately. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can contact your provincial Poison Control Center. Symptoms of an overdose may include changes in the amount of urine, which could indicate kidney problems. It's important to have lab and medical tests, like checking your iron or ferritin levels, while using Panhematin Vial. Make sure to keep all your appointments with your doctor and for any necessary lab tests. If you have any questions, consult your doctor for more details. If you forget to take a dose, make sure to talk to your doctor or pharmacist to figure out when to take the next one. This medication is not available for home storage and can only be administered in a hospital or clinic setting. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.